All right. Thank you everyone for tuning in. My name is Kavi Devulapalli. I'm an interventional radiologist. I'm at Image Guided Solutions in Missouri, and today I want to take some time talking to everybody about vein disease, what I think is a very overlooked and misunderstood condition. About myself, again, I'm a vascular and interventional radiologist. I grew up in Ohio. I did my medical school at Case Western Reserve University. I ended up moving to California to do my residency in diagnostic radiology, and then I moved to North Carolina to do a fellowship in vascular and interventional radiology, which is what I practice today. I've been in practice for over 7 years now. I had an independent clinic where I was living in North Carolina, where I practiced for the first few years of my career. And my family and I have since settled in Columbia, Missouri, where we've lived now for a couple of years. And I've had the honor of opening up an independent practice. We're Image Guided Solutions in Missouri, and we are teamed up with Columbia Orthopedic Group, who have been great partners for us. This is my team, myself and my assistants, Casey and April. I have a sonographer, Kelly, as well, who's wonderful, but we do need to get a picture of him. We're housed in the Columbia Medical Plaza. We share offices with Columbia Podiatry, which is also a part of the COG network. We are on 305 North Keene Street, and that is the outside of our office. I want to talk to you all today about vein disease. And really, the point of this talk is to go over a few things, and I really want you all to leave understanding what vein disease is and why detection and treatment matter, and specifically how our practice can help and how we are uniquely positioned in our area to really maximize patient outcomes. So, when I first meet with the patient, the first thing that we discuss are blood vessels in general. And in order to understand blood vessels, it's important to distinguish between arteries and veins. So arteries are kind of like the water lines to your house. Water is essential. Without water, unfortunately, you will not live. And arteries are very much the same way. If you cut off an artery to a part of the brain, you get a stroke. If you cut off an artery to your heart, you could end up with a heart attack. If you cut off an artery to your legs, you may potentially need an amputation in that leg. So arteries are very important. Veins, on the other hand, are often overlooked because they're kind of like the sewer lines leading away from our house. You can cut a sewer line and you can still live, it'll just stink. And that's what vein disease is like. Veins have the hard job of taking blood that has already been deprived of its oxygen and used by our tissues as fuel, and it takes that blood and brings it back to the heart and the lungs in order to get oxygen. And in the legs specifically, the veins have a hard job because they have to fight up against gravity. But it gets a little bit more involved than this. There are two types of veins, and we're going to keep it very simple. There are the deep veins that live deep in our muscle. And I tell folks that this is similar to like the large highways. These are like the I-70s of our legs. These are big vessels that bring back a lot of blood up to the heart. But not to be overlooked are a network of superficial veins. These are veins that live above the muscle, and they have a pretty important job too. And oftentimes, these are the veins that become damaged in vein disease and can cause a lot of symptoms. And we'll talk about that. So, what exactly is vein disease? If you were to take one of those veins that I just put up on the slide and take it lengthwise and cut it, you would look on the inside and notice that about every 2 to 3 centimeters along that vein, you're going to find these little valves. And when our muscles squeeze, these valves open up, and that helps propel blood back up to our heart. And specifically, we're talking about the veins in the legs. Now, what happens in vein disease is these valves break apart. So when our muscles squeeze, these valves no longer just open, but they don't close. And that lack of closure is a problem because now you have gravity that's able to act on these blood cells and just drag that blood back towards our feet and ankle. And that can cause a lot of issues. So that's the premise behind vein disease. It's damaged valves. Well, vein disease is very common. There's over 175 million Americans who have vein disease, over a billion people across the globe. It's more common than diabetes, peripheral arterial disease, heart disease, cancer, strokes, Alzheimer's, and all sorts of maladies combined. That's how common it is. In fact, for those of you watching it, there's about a 50% chance that you might have vein disease yourself and you probably don't know about it. The thing about vein disease is it is a progressive disease and it's not a life or death situation, but you can definitely have problems with your quality of life and suffer. So that's why it's important that we understand what this is because there are things that we can do to help make it better. And what puts you at risk for having vein disease? There's a few things. So as we get older in age, that's definitely a factor. Genetics is a tremendous part of it. Even the youngest, healthiest patients can still have bad vein disease, and that oftentimes is due to genetics. DVT, that stands for deep venous thrombosis, otherwise known as a blood clot, that could predispose patients to having damaged valves. Phlebitis, that refers to inflammation in the veins close to our skin. That happens, and that can cause issues with their veins. Obviously, there are other factors as well, being overweight, spending a lot of time on your feet. For women, a big one is just even having a pregnancy. And of course, multiple pregnancies are a factor because when women get pregnant, the veins have to dilate and get bigger to accommodate um, basically blood flow for two humans. And when that happens, the valves in the veins are at increased risk of becoming damaged. So many women often notice vein issues after pregnancies. And then being female as well, because there are effects of estrogen on the veins that can impact how dilated they become. So, what does vein disease look like when you see patients and you just think about it, just the general person out there? I think the first thing that's apparent to a lot of people is varicose veins. They notice these large, ropey veins that are under the skin. And this is a pretty exaggerated example. On the inside of this patient's knee and end of their thigh, you can see these really ropey veins. But you also see a lot of little scattered blue spots and areas that look like that, which are really smaller spider veins. But the thing is not everybody looks like this who has vein disease. You may not look like this at all and still have a lot of problems related to your veins. Oftentimes, this manifests as heaviness. It's kind of aching, tightness, or fatigue. If you ever feel like there's just a sack of potatoes tied to your legs as you're walking around, that's a common symptom that people feel. Feeling pain and swelling. If you have pain, especially where these superficial veins are, and we'll talk about that anatomy, but oftentimes it's on the inside of the calves and thighs, that's a factor. Restless legs is probably one of the biggest factors that we see that is overlooked. We have many patients who see multiple specialists to evaluate restless legs. They might be put on multiple medications, and oftentimes vein disease is the number one reason for restless legs. So we have patients with nothing but restless legs, and then we realize they have vein disease, we treat them, and they get much better. Numbness and itching. Numbness, and there's also tingling and burning in the feet and the toes, swelling down there as well, could often be a manifestation of vein disease. Having skin changes. Now that we're in the summer months and it's hot outside, you see people in shorts. Take a look around and take a look at folks' ankles and calves and shins. And if you ever see redness in those areas, that's oftentimes vein disease. And then for the patients who have it the most severe, the skin could actually break down and you can get ulcers or wounds potentially. And those are pretty severe stages of vein disease. Of course, we work with our orthopedic surgeons here at Columbia Orthopedic Group. So we help out our folks over there. And there's a lot of vein disease in the orthopedic population. For those of you who may be viewing this and might be considering a total hip or a total knee, just know that vein disease has significant implications for that. We'll talk about that in a little bit. But we see patients with varicose veins, ulcers, neuropathy, that's numbness, burning, tingling sensation in the feet, and restless legs as well, as we mentioned, that restlessness. So for the orthopedic population specifically, vein disease detection definitely matters. And there's a research study here, and there's been several, but the important point that I want to get across is untreated vein disease in itself can be a risk factor for blood clots in patients who end up getting orthopedic surgeries, such as hip and knee replacements. So we like to detect vein disease as soon as possible in these patients and ideally have them treated before they undergo a joint replacement or other big surgery, because that can really make that surgery safer and it can help maximize a patient's outcome so they'll have reduced swelling and get back on their feet sooner, which is what we all want. So how can we help with vein disease? Well, we can do a few things. We could diagnose it, We can treat it, and we could also be there for patients throughout the course of their life to help take care of them because this is a lifelong condition. So the diagnosis, it's important to meet patients in person where we'll do a full history. We'll examine you. Oftentimes, we'll take a look at your feet and your legs. Shoes come off. We see how much swelling you have. We look to see where the veins are, if they're visible. We feel for pulses as well, just to make sure the arteries are normal. And then really the cornerstone of our examination is the ultrasound. The ultrasound is our eyes to what's underneath the skin, where we take a look at the veins. We look at both the deep veins, which are those large veins that bring the most blood back to make sure there's no blood clots, but we also look at the superficial veins, and we actually measure the amount of time where blood is flowing the wrong way. And that gives us an indication as to whether or not vein disease is present. So in terms of history, it's often the same symptoms that we had mentioned before, but I'm reiterating this here because they are important. Tired and heavy legs, swelling, restlessness, cramping, especially cramping at night. That's often a common symptom. And then, of course, for severe vein disease, there's poorly healed wounds that we see in the calves and the shin area. And then there's other things too as well. Neuropathy symptoms as well are very important. When we see patients in the clinic, at least on the physician side, what we're focused on is classifying this disease. And we use a classification called the SEEP classification. And there's a lot that goes into this, but all these details aren't important for our patients, but it gives us an idea on the doctor side how severe something might be. And really what it comes down to is the clinical manifestation and what we see. And when we look at patients, we basically classify them into one of six stages. And if you start at the top left and work across the top row, go to the bottom left and work across the bottom from left to right, you'll see the stages of this disease. C1 usually refers to just a few spider veins, a few little marks on the skin, nothing ropey. And this is very common. And oftentimes, many patients think, oh, well, maybe it's just a cosmetic issue. And a lot of doctors even brush it off and say, hey, that's okay. You got a few veins here. It's just a cosmetic issue. But usually, this is just a tip of the iceberg. So, oftentimes, when patients have these types of veins, there are more times than not issues with the deeper veins underneath. So, when we see a patient like this who also has the symptoms that we mentioned, then we'd want to take a look a little closer with an ultrasound if possible. When the disease progresses, it's possible to get those ropey varicose veins. We saw a picture earlier. Here's another example of a patient who has them in their calf on the inside of their foot and ankle. Then when things get progress even more, we get really bad swelling, and that's C3 disease on the top right. That's very common. And it's not unusual for patients to kind of skip over this ropey vein phase and just go straight to swelling. And it doesn't mean that they don't have varicose veins. Oftentimes they do. And when things get really bad, that's when we start seeing changes in the skin. So on the bottom left, that's C4 disease. That's where we start noticing this redness. And that's what I mentioned earlier. If you just go around when you're out and about this summer, you take a look at people, you'll notice this in a lot of folks. What happens is when the skin breaks down, you get ulcers. C5, that refers to an ulceration that's actually healed. It was once an ulcer and now it's kind of healed over. And C6 is where you kind of get that raw red skin on the middle of that area of ulceration in the ankle or shin. That's an active ulcer, and that's the most severe stage of vein disease. When we're looking at patients and we're thinking about them from an anatomical standpoint, again, we mentioned the two types of veins earlier. There's the deep veins that live in the muscle, and there's the superficial veins that live above the muscle. And really, when it comes to venous anatomy, we're oftentimes focused on the superficial veins because those tend to be the veins that are diseased in patients who have a lot of these symptoms. We do have many patients as well who have a history of blood clots in their deep veins, and that can impact things as well. We're best equipped here to deal with both issues, so it doesn't matter if you've had a history of blood clots or not. We are able to diagnose your issues and take care of you. But I would say for the vast majority of patients we see, their deep veins tend to be normal, and their superficial veins are the ones that have the issues with the valves that we mentioned. And when it comes to venous anatomy, there's two veins we primarily look at. There's a great saphenous vein, which is a vein that runs from the inside of the thigh all the way down to the ankle. And then there's a small saphenous vein, which basically runs from the back of the knee down to the ankle behind the calf area. So what we do when we're evaluating these patients is our sonographer will have a patient stand and we'll take a look at these veins. And what we'll do is we'll actually put a little probe using our machine. We're able to time the amount of time that blood flows backwards in these veins. And if we were to measure this and see that the blood is flowing backwards, that is to say towards the ankle and the feet as opposed towards the heart, greater than a half-second period of time, that indicates to us that a patient has significant vein disease. The important thing that we tell patients is there is unfortunately no cure for vein disease. The good news is it's not a life or death situation. The bad news is we don't have a magical cure, but we have a lot of options to manage it. And really our goal is quality of life and to make patients feel better. And that we can do. And in order to treat vein disease, I tell patients it's no different than going to the dentist. I wish you can just go to the dentist once and never go back again, but we all know that's probably not a great idea. Vein disease is no different. That doesn't mean that patients need treatments every year, but what it does mean is when we do meet a patient and we diagnose them with vein disease, we want that patient to follow with us and we want to follow them for the course of their life because vein disease is the gift that keeps on giving, unfortunately, and we want to be there for patients. So we're going to talk a little bit about the treatment options we have and how they can help. So treatment options basically come down into two varieties. There's non-interventional treatments, and then there's interventional treatments. It used to be that surgeons would do open surgery for vein disease, but I would say over the last 20 years, that is pretty much no longer the case. And now vein disease can be managed primarily with minimally invasive techniques that we can perform in the office. So the first line is compression. And in order to, treat patients properly, the first thing that we will do is we will prescribe compression stockings. And what compression does is it actually helps squeeze the blood out of the veins. And that's very, very important because if your veins are not working properly, you need something to help propel that blood up because it's not propelling up sufficiently on its own. So compression is vital. Whether or not a patient receives a vein treatment or not, compression is going to be something that we encourage all patients to wear. And it is challenging to wear compression, especially when you look outside and it's 90 degrees outside. Compression socks can be kind of warm. But the one thing we tell patients is it's not mandatory to wear these things every day. We usually encourage patients to wear them for about 2 days on in a row, just wear it during the day. I'd say 9 to 5, treat it like a job, and take it off in the evening hours. That's fine. We want patients to get into the habit of wearing it with some regularity. I would say on average, if a patient could put on compression for at least a period of time that's sufficient for at least several hours, at least 3 days a week, that's pretty good. What we really want to do is we just want to help support the veins. The truth is that there are a subset of patients, maybe earlier in the disease process, where compression is all they need. They may not need a lot of fancy treatments. Maybe a little compression could be all they need to feel better. And speaking as someone myself who has vein disease, at my age, I'm fine with compression, but I'm sure there may be a time where this will progress and, treatment might be necessary for me to feel better. And those treatments really come down to interventional treatments. And the first one I want to mention is something that we do every day in our office. It's called catheter ablation. And what catheter ablation does is it effectively removes the faulty vein, the vein that isn't working, from our circulation. We're not physically removing the vein. We're not cutting anything open. What we're doing is we're taking a tiny pinhole in the skin and we're inserting a catheter. And we're going to use the catheter to basically close the vein. There's several options. There's thermal options, which just basically means heat. We could either use laser energy or radio frequency energy to close the vein. And then there's non-thermal options as well. And one of those options is glue, where the vein can be glued shut. So there's a few different ways to do it. We tend to favor radio frequency ablation. This is something that's pretty easy to use. This is a system that we like to use, but basically what matters is at the end of this little catheter, it's almost like a spaghetti string. This catheter has this metallic area where it is able to apply heat to the inside of the vein. So when we do these procedures, what we do is we target the main veins in the leg that aren't working properly. And this is actually a live shot from our own office, where what we're doing is we've accessed the vein at the calf. This is treating the small saphenous vein. This is the vein in the back of the leg. What we do is we use an ultrasound to guide a little catheter into the vein. And then what we do is we numb up the area around the catheter underneath the skin to make sure that we heat the vein, but we don't heat the adjacent tissues, so we don't cause any damage. The risk of having nerve damage or tissue damage from what we do is exceedingly rare. I'd say it's less than 1 in 1,000. So these are very safe procedures, but we do need to make sure things are numbed up. And then what we do is under ultrasound, we apply this heat and we kind of watch under ultrasound as we close the vein shut. Now, this is just part of the treatments that we do because what we are doing is we are effectively closing the main trunk, but there are all sorts of little branches that come off of these main trunks. And the body will find new ways to create pathways around the main trunk. So in order to help patients get the maximum benefit from vein treatments, after a catheter treatment, we will move on to something called sclerotherapy. Sclerotherapy is basically a medication. It's a foam detergent that we make with a liquid solution that we mix with air. And what we do is we use ultrasound to guide a tiny little needle into these small branches that come off of these larger trunks. And we then inject these tiny branches with this medicine, and that'll help close these veins and shrivel them off. And that's something that's very effective because by closing off all these side branches, then what we're able to do is we're able to increase the amount of time a patient may need before they might need a future treatment. So that's very good. So we try to make our treatments as effective as possible. The outcomes are very appealing. You can imagine what it's like to have all these ropey veins in your calf and then see them disappear. So I would say something like this is entirely achievable. It's pretty routine for us, and we generally see an effect like this, I would say, over the course of a couple months. So it's very good. And what's not being told in this picture is how a patient feels. So by having a lot of these veins treated, patients will have more energy, their legs will feel lighter, they'll be able to ambulate or move around easier. So it's all very encouraging. The logistics on our end are relatively straightforward. These are all outpatient procedures. So we do this in our office that we share with Columbia Podiatry on 305 North Keene. Um, you don't need to be in the hospital to do this. I would say the vast majority of our patients do not need any sedation. I would say 9 out of 10, that's the case. We do this with local anesthesia. We do have some patients who get nervous about needles, and that's normal. That's okay. For those patients, we do prescribe some medication that they can take, pick up from their pharmacy, and bring to our clinic and take it to basically kind of take the edge off, and that's very helpful. The procedures are pretty quick. Sclerotherapy sessions could last anywhere from 15 to 30 minutes. The catheter sessions could last anywhere from 30 minutes to an hour. We've even had patients come in during their lunch break and we've treated them. So it's a very low risk procedure. It's well tolerated. There isn't really any downtime. You're pretty much able to get back to activities pretty quickly. I'd say on average, it takes several visits for each leg because there's multiple veins that need to be treated. And what we want to do is we want to make sure we have a complete response so we can kind of take care of this for the time being at once and give our patients as long of a period of time as possible without needing another treatment. However, we do understand that these treatments are a commitment. It's hard to make time in our busy lives to come to see the doctor multiple times. So we do have some patients where we do work around their schedule and we can spread these treatments out over the course of several weeks. Of course, it's not a one and done. We follow up our patients. We see our patients routinely 6 weeks after treatment. We see them back in 3 months and we keep an eye on them every year. So we get to know our patients very well and we love taking care of them. And what's important to note from an insurance standpoint is this is covered by all insurance carriers. Different carriers have different rules. These are rules that we're well aware of that we keep in mind. So we're able to tailor our treatments based on the different rules for different insurance carriers, so our patients aren't stuck with big bills, which is very key. So we're able to figure that out. Our practice, again, we're with Columbia Podiatry as part of Columbia Orthopedic Group. We're Image Guided Solutions in Missouri, and we're at 305 North Keene Street. And we're the only outpatient vascular and interventional practice in mid-Missouri. We provide comprehensive vein disease. Today, this webinar was to really talk about superficial vein disease, but we do treat patients as well with deep venous disease, chronic venous disease. So pretty much anyone with leg swelling or pain, we probably have a solution for them, and we would be happy to see anyone. That's my email address, and that is my personal cell out there. So feel free to reach out to me with any questions that you may have, and I appreciate your time.